Hi, Kirk.
Hi, Kirk. Is that camera lagging?
Yeah, it always lags a little bit. Think back to a time when you or a loved one was in the hospital. Who was the person who spent hours by their side, constantly monitoring and taking care of them? Chances are it was a nurse. This topic should be important to you because we all need healthcare at some point in our lives. Nursing is one of the most rewarding but demanding jobs out there. I'm going to share with you what nurses do in their day-to-day lives, the qualifications to become one, and the impact that they have on the community. Now that I've outlined what we'll be talking about, let's talk more about specifics. The main job of a nurse is to promote health, help prevent illness, and care for those who are already ill, disabled, or dying in all stages of life. Nurses must be able to execute skills whenever, and they have also mastered them during nursing school. Nurses must be able to assess patients, pass meds, monitor their progress, teach patients what they're doing, and pick up on a critical change in a patient and act accordingly. Nurses often use these stethoscopes to help assess their patients and act on what they need to based on what they hear. According to the Cleveland Clinic article, What is a Nurse? Types of Nurses and Roles, the article states people often describe nursing as an art and a science. Nurses apply not only scientific knowledge but their own observations of patients to meet their specific needs while also providing emotional support and empathetic care. Now that I've talked about what nurses do, let's talk about the requirements to become one. After high school, you must apply to an associate's degree in nursing program at the school of your choice. According to a 2024 Forbes Advisor article about becoming a registered nurse, completing a nursing education is the first step to becoming a registered nurse. In most states, the minimum requirement for an RN license is a diploma from an accredited RN program. However, most aspiring nurses earn an associate's degree in nursing or a Bachelor of Science in Nursing. After passing the board exam or the NCLEX, most nurses choose to pursue a higher level of education, such as a bachelor's degree in nursing or their nurse practitioner's license. Most students graduate between 2 to 4 years, and some hospitals even offer to pay for your further education as long as you work for them during that time. Finally, I'm going to discuss the impact that nurses have on the community. Nurses help improve health outcomes and patient satisfactions, and those are key players in public health. Most nurses help make patients feel more comfortable and understood. According to the American Nurses Association 2023 article titled, How Nurses Can Affect Positive Patient Outcomes, keep your patient's values, needs, and preferences top of mind through treatment. Patient-centered care promotes independence and engagement and correlates to improved health outcomes. Patients are typically happier when you ask for their input based on further care. It is important to build relationships built on your patients' different cultures and beliefs, and it helps them feel like you're more connected, and it helps make them feel more understood. Nursing is not just about direct medical care, but it's also about building relationships with your patients built on trust, respect, and independence. Nursing is a rewarding but demanding job and plays such a huge role in our lives. Today I discussed what nurses do in their day-to-day lives, the qualifications to become one, and how they impact the community. Based on what I discussed, I hope you can be more empathetic with nurses and what they do to their day-to-day lives as they experience so much. Thank you.